For our next speaker, I would like to invite Dr. Vaishali Deshmukh, whom we have seen work tremendously hard to make all of the previous conferences successful. Dr. Vaishali Deshmukh is MD, DNB gold medalist in internal medicine, and she has done her DM in endocrinology. She's working as an assistant professor in endocrinology at Sassoon General Hospital and BJMC in Pune. She's the consultant and head for Dinanath Mangeshkar and Deshmukh Clinic, Pune. She is also invited as a faculty for about 932 CMEs, webinars, interviews, and conference. She's the founder and secretary of the NGO Sphere. Her awards include the Gold Medalist Award, the Proficient Woman Award, Kranti Surya Pratishthan Award, Adarsh Mahila Puraskar, Jeevan Gaurav Puraskar. She has 22 publications. She has also authored 4 chapters in 4 books and press, and she has published 60 global phase clinical trials in endocrinology and MBM research. I would like to hand over the mic to Dr. Vaishali.
Thank you, Dr. Madhura, for that kind introduction. And I would like to represent as a secretary of Sphere as to what activities we have been doing, and we would like to reflect on this. So I would like to share my presentation. Can I share my slide, please? Yeah. I hope my slides are visible. Yes. So, as we heard Dr. Chaitan mentioning that Sphere stands for an acronym. The acronym is SPHERE, and of which P stands for Prevention of All Non-Communicable Disease. H stands for Healthcare for All. Then E stands for Education of Community, Doctors, Nurses, Paramedics, Organizations, Societies, Industry, and Institutions. R stands for Research in Non-Communicable Disease, Endocrine Disorders, and Cancers. And in this, we have a common motto of women health and mind health coming into all these categories. So that's how we landed up with Synapse. And our journey has taken the footsteps through conceptual framework, operational framework, translational framework, training and education. So we have been working on these fronts simultaneously right from the inception. So laying the concept was a difficult task, and I should thank all the mentors and the patrons who have supported me in this cause right from Synapse 2020. And CBM Trust has been very proactive in terms of taking this concept ahead at various stratas in the society. So these were the 3 conferences, the Synapse 2020, Synapse 2021, and 2022. So the initial first conference was mainly to lay this concept of mind-body medicine in endocrinology and diabetes, because it was not described in books till then. And even now, literature has very few documentation on this whole concept. So setting a context of getting this concept into the generation which is practicing diabetes and endocrine was the first thing. Second is that how you help the lifestyle intervention in a very practical fashion. This was what was taught in the second conference. The third conference, which was done last year, was mainly focusing on how to improve quality of care adherence. And now we have moved a step ahead in terms of giving this kind of therapy as an adjunct to pharmacotherapy. So we are talking about pharmacotherapy as the therapy for illness, and adjunctive therapy of mind-body medicine as adjunct therapy for wellness of those ill patients. So it is like illness covered with diabetes control and wellness of a diabetes patient being dealt with mind-body techniques. So it is like a synergism of these 2 therapies. So this conference is mainly going to focus on this synergistic combination of pharmacotherapy and adjunctive role of these mind-body medicine. So what concepts have been brought about by Synapse was mind-body medicine, then putting diabetes as a network science disease where integration is a must. Then psychoneuroimmune endocrine model was described first time. And apart from that, we have come up with certain new assessment of health strategies, especially the CGI health, the CGI, the comprehensive global assessment of diabetes, and then the concept of autonomic health and autonomic hygiene. So all these concepts have been the cornerstones on which the organization in collaboration with CBM Trust is working, and Indian Psychiatry Society has been very cooperative in this endeavor. So, as I said, this not only was it preached in conferences, it was also practiced in our clinics, and it led to design of two important questionnaires: the Mind Health Assessment Questionnaire, the PNI questionnaire, then the CGI Health Assessment Questionnaire, as well as the CGI Diabetes Assessment Questionnaire. And these four questionnaires were implemented. Their studies are being published for these, and we will have soon data coming out with these studies, which are long-term prospective studies. So what has eventually happened is that we have been able to uh, get into the society, to a general practitioner, the concept that mind-body medicine can be useful right from the primordial prevention level to primary and secondary prevention in terms of improving compliance and adherence to therapy, and in terms of tertiary care, that is improving the resilience and the survival and quality of care of terminally ill patients. So all this, like a pyramid that we usually follow for any NCD, mind body medicine forms the base of that pyramid, and that is what we are trying to look, that this has to be offered to the masses beyond what we are giving as pharmacotherapy and other lifestyle interventions. As far as the research and the operations are considered, heart rate variability studies are in progress with cardio-autonomic studies, the CGI health, the CGI diabetes, and yoga and autonomic nervous system studies are in place with various collaborators. Now, patient workshops and mind-body clinics have been an integral part of our activity right from the beginning. But first time in an institutional setup, mind-body clinic has been started by Dr. Leena Fadke and Dr. Priya Mardikar in the physiology department of SKNMC Pune. And I think that's a huge success of this whole story. And I would like to congratulate the team on that. In publication, our various processes, we have chapters on PNI in health and disease in the ESI textbook, which is awaiting publication. Yoga for diabetes prevention, which is also awaiting publication, and prediction of micro and macrovascular complications in type 2 diabetes using heart rate variability is now sent for publication. So these are the publications which are in place with all the activities that have been done so far. As far as the autonomic health aspect is considered, digital innovative health solutions have been looked into, and with the help of technology, we could come to this concept of this Chronovisor Tele-HRV, which is a digital health solution for easy detection of the cardiovascular risk in diabetes. And this is indigenous, I think it is 1st April today. It's not only April Fool Day, it's also DIY Day. So do it yourself. And this is the first technology in India which is indigenous in nature, which is easy to use, and that whole team involved in this R&D has been useful in designing this technology, which has been very handy and non-invasive in nature and at the cheapest cost. So you can see that this technology is non-invasive, the skill requirement is low, the cost is low, however, the sensitivity is high. So as compared to all the other tests, which are quite expensive and invasive, we have been able to design this standardized test for cardiac autonomic dysfunction detection. And it's just this handy device giving us a clear picture of the autonomic status. This data was presented by us at RSSDI Ahmedabad way back in 2018, and now it's a time where we are implementing into the society. It's already been presented in the ESG, and the artificial intelligence methodology using this data has been presented in USA also. The technology has received numerous awards for innovation, and now we are planning to take this technology to every physician and every general practitioner who can assess the cardiodiabetes vascular risk. So coming to the operational framework, the 2-minute mind body health questionnaire was designed by us, and which was published in the American Association of Clinical Endocrinology in 2022. And this questionnaire was forwarded to the team of collaborators, and Dr. Kirti Samudra from our team, Dr. Pradeep Kumar Modi, have designed their own strategies for psychosocial counseling, and we'll be hearing more from them as to how they have taken this ahead. And HRV studies are being undergone for cardiac autonomic assessment. So as I said, that patient education and patient centricity is our goal, and that's why we go to the community every now and then with these concepts. And the reason why we did this fellowship was the same, so that we could take it to the interiors of the country, and we had people coming from all over India, even from outside India, to for understanding this concept of mind body health. The first fellowship program, which was done last year, it was well appreciated. It was a 4 days workshop, and this was the first batch which passed out. So this year we have this workshop on 20th to 24th July in Pune, and I welcome all of you to be a part of this. So the future is, what we are looking forward is opportunity for health promotion in diabetes. We're looking at yoga as a neuroscience technology, looking at concept of autonomic health and hygiene, identifying autonomic arrhythmia as a marker of stressors, then corrective strategies to help this autonomic arrhythmia, and to get a uniformity of health assessment and illness assessment in diabetes as a CGI, and making mind-body medicine as an integral part of diabetes and NCD management. Of course, it's not an individual work, it's a team of collaborators who have come together, and it's not only a national team, an international team working in the background. So that's all. And before I end, I would like to say that knowledge is telling the past, wisdom is predicting the future. So this is what we want to share, the wisdom of all the eminent people, and that's why you see the faculty is such that they would be sharing their pearls of wisdom with the whole audience, and I'm sure you'll enjoy that. Thank you so much.
Thank you, Dr. Vaishali ma'am, for that enlightening reflection of the past work of Synapse. So since we are done with the first part of our conference, I would like to hand over my duty as a moderator to our next moderator. Can I please have the CVs for the moderators?